Thank you all for participating in today's press conference. This is our 23rd since the start of the pandemic. These press conferences reflect UPMC's ongoing commitment to provide timely and accurate information for all. Before we begin, however, on this Veterans Day, I'd like to acknowledge the nearly 1,200 veterans and active reservists who currently work at UPMC, the thousands more we care for in our 40 hospitals, and all of those who served in our military. Thank you for your service. Today, I'm joined by Dr. Don Yealy, UPMC's Senior Medical Director and the Chair of Emergency Medicine, and Dr. Rachel Sakrowitz, Chief Medical Officer of the UPMC ICU Service Center and Executive Vice Chair of Critical Care Medicine at UPMC. They will share with their expertise regarding UPMC's preparedness for the current expected increase in COVID-19 cases we are seeing in the communities we serve, and offer clinical insights that have resulted in better patient outcomes. After our experts give their remarks, we will gladly take your questions. Dr. Yealy.
Thank you very much, Paul, and thank you all for attending today. As we and our public health colleagues expected, cases of COVID-19 increased across the nation and across the communities we serve over the past month. We believe that many factors triggered this increase. That includes masking compliance opportunities, cooler weather, and more close gatherings, especially indoors, in either small numbers or larger numbers. There's no one cause or one pattern emerging beyond human contact and impaired protection. There is no one population that drives infections. Anyone can contract the virus. The harm is still more strongly noted in the elderly and those others who are vulnerable from existing conditions. Many activities can cause an increased opportunity for infection. It's not just nursing homes, it's not just younger people gathering in social settings that is prompting the increase in community cases. However, we are seeing some regions that have higher rates than others. For example, the Altoona region and the Western Maryland regions have disproportionately higher numbers of patients hospitalized with COVID-19, while southwestern Pennsylvania just yesterday hit the same 7-day average as we saw in July. This underscores why being part of UPMC allows, with broad resources and facilities that stretch across Pennsylvania into neighboring states, we can respond effectively to the needs. It makes us well positioned to weather this pandemic. When one area needs assistance, the whole system can respond to aid. And as we continue to see over the recent months, the COVID-19 cases that result in hospitalization are less severe than they were in the spring, and they're not resulting in high numbers of patients requiring breathing machines, intensive care, or dying. We saw different patterns earlier on. My colleagues and I often hear about COVID-19 fatigue, and that's when people are tired of wearing masks and want to gather with relatives or friends and enjoy celebrations. We understand fatigue, but we caution everyone, stay vigilant. The virus doesn't care about our fatigue. We must continue to practice the basic public health principles that we know work. Wear your mask. Wear it properly so it covers your mouth and your nose. Don't remove it to talk. Don't remove it to cough or sneeze. It isn't a guarantee that you won't contract the virus by wearing a mask, but it decreases the likelihood. And beyond that, many suggest that people who are wearing masks when they're exposed, even if they happen to contract the virus, have less severe symptoms and are more likely to recover. Wash your hands frequently, particularly if you touch any common surfaces or your mask. Stay home when you're feeling sick. COVID-19 has many different types of presentations, and it can be spread by almost anyone, even people with mild symptoms. If you have any concern that you might have COVID-19 illness or infection, call your doctor, set up a video visit, and determine what the next best steps are for you. If you can, practice physical distancing. If you must gather with others, indoors or out, maintain a 6-foot distance between you and people you do not live with, even if you're wearing a mask. In addition to these public health practices, there's something else you can do that's very important. Keep yourself healthy. Get your influenza vaccine that helps protect you from another common virus that also creates illness. It works. Keep your regular healthcare visits, annual physicals, preventative screenings, visits with your specialists, dental and eye care appointments are all important. We've learned a lot over the past few months, and we know that healthcare facilities are safe. Delaying your care is not safe and it's not smart. You may jeopardize your health by delaying or skipping care. Come right away if you have any emergent conditions. If you think you might be having a heart attack, having any breathing difficulty, stroke, or if you had trauma, go to your nearest emergency department. Don't delay. We are ready to provide your care, and our emergency departments are safe. You will not catch COVID-19 by coming in for emergency care. If you and your healthcare provider determine that you need a procedure or you need surgery, even if it's not an emergency, get that procedure scheduled. There's a reason that you have this care scheduled and a reason why you and your doctor decide upon it. You should receive it as soon as it's reasonably possible. Now my colleague, Dr. Rachel Sakrowitz, will explain why UPMC is confident that we can continue to provide the high level of care that you expect from a world-class academic medical center for any condition, including continuing the care for patients with COVID-19, no matter what those numbers are.
Thank you, Dr. Yealy. As Dr. Yealy said, we have learned a lot about caring for patients with COVID-19 in the past several months. Not only have we learned a lot about the virus itself, how to identify it, how to treat it, and how to mitigate its spread, we have also learned a lot operationally in terms of how to effectively utilize our entire health system's resources to provide uninterrupted care for any medical condition, even in the event of an increased number of COVID-19 cases. Over these next few minutes, I will cover where we currently stand from a research and medical perspective, then from an operational perspective, and finally, how we are bringing it all together to provide safe, high-quality care during these very unusual times. First, in terms of the virus. The good news is that compared to the spring, our COVID-19 patients are far less likely to need intensive care unit care, and patients who do end up in the ICU are far less likely to need the support of a ventilator. In fact, our mortality rates, our ICU admissions, and ventilation rates have dropped by 50% since the spring. We primarily attribute this to two things. First, improvements in clinical treatment, especially thanks to our REMAP COVID-19 clinical trials. REMAP is a clinical trial platform that provides patients access to breakthrough treatment regimens in real time. REMAP is available to all of our patients across the entire UPMC health system, whether 4 hours away in Williamsport or 4 minutes up the road from me at UPMC Mercy. At UPMC, we are enrolling patients in REMAP at a faster clip than almost any other clinical trial, with more than 1 in 5 UPMC patients with COVID-19 taking the opportunity to participate. We learned that giving corticosteroids to hospitalized patients when they begin to require significant breathing support vastly improves chances of survival. We also learned that when combined with corticosteroids, it is often safe and effective to use high-flow nasal oxygen instead of a ventilator to support COVID-19 patients with respiratory failure. Compared to 30% in the spring, today only 14% of our COVID inpatients require ventilator support. The second reason is masks. As Dr. Yealy said, even if the mask doesn't guarantee you won't contract COVID-19, it does block some of the virus so that you likely get a lower dose. We think that this may give your body a better chance to mount a successful immune response. Now I'd like to discuss our operational readiness. Over the past months, we have optimized our operations so that we can quickly scale up our ability to handle increasing COVID-19 cases in our communities. Across our system, COVID-19 patients currently occupy less than 7% of our inpatient beds, and we remain fully able to care for all patients with or without COVID-19. All UPMC hospitals, facilities, and providers have the support of our world-class academic medical center, and should the need arise, we can add and share resources, transfer patients, and mobilize staff between facilities. So how does UPMC bring this all together? Simply put, we have an amazing team. I want to express my deepest gratitude to our 90,000 plus dedicated essential employees. This isn't easy. I know that. The challenge we faced in the spring was one of uncertainty, fear, and disruption. Because of your dedication to our mission, we made it through. Our current challenge is to continue to meet the needs of our entire patient community in the face of a virus that just won't go away. This is a scenario that we've been planning for over the past many months. We have new telemedicine capabilities that expand our reach. We have physical space solutions to accommodate additional patient volume. And we have new protocols that reflect our more advanced understanding of treatment and transmission. And most importantly, we have each other. It is because of your values, hard work, teamwork, and dedication to our healthcare mission that Dr. Yealy and I are able to promise our communities that UPMC is prepared to care for them through these unprecedented times. Thank you. We are incredibly proud and incredibly grateful. To our entire community, if you need care, whether scheduled or emergent, please do not hesitate to come to UPMC. We are ready, and our facilities are safe.
Okay, thank you, doctors. And now we'll take questions from the media. To ask a question, you'll have to go to the participants icon at the bottom of your page and press the Raise Your Hand button. That will put you in our queue. I will read your name and your line will be unmuted for you to ask your question. Please make sure to unmute your microphone on your end. We'll try to call on as many different media outlets as we can in the time that we have allotted. We also have a number of email questions, and I'll get to one of those first as we're waiting for people to raise their hand. Our first email question: what are your thoughts on Pfizer's announcement this week that interim results show its vaccine to be 90% effective against COVID-19? Dr. Yealy?
That's a very good question, and the Pfizer information yesterday was very, very exciting. It's encouraging news that a COVID-19 vaccine could have 90% efficacy. That's a fantastic development. It's also exciting because the particular mechanics behind this vaccine uses RNA, part of what the virus makeup is on the inside rather than the outside. And if this virus vaccine makes it to market, it'll be the first of a kind that uses that particular technology. And that really not only could help us with COVID-19, but with other vaccines. But I want to temper my enthusiasm by cautioning that it's still early. The results need to be confirmed. We haven't had a chance to go through them with a fine-tooth comb. And then this vaccine has to be manufactured and distributed widely in order to have optimal impact. We know that in some populations, it may not reach the same effectiveness rate as was seen in the trial initially. And so we have to be careful about that. Vaccines alone are an important part of the solution, but they're not the only solution to the COVID-19 pandemic. So we need to stay on course with other therapies. We need to develop other vaccine candidates that work better, and we need to work on our antibodies, which actually provide you with the immunologic response, rather than depending on your ability to make it. We are still progressing at UPMC with our AB1 and AB8 antibody therapies, hoping to provide that protection for people who may not be able to generate such protection through a vaccine. We also heard good news this week that FDA had increased emergency use authorization for another antibody treatment. Again, these are more tools to help us attack the COVID-19 pandemic.
Yeah, I would add just that even before we have a vaccine ready for distribution and after, it is still essential that everybody is vigilant about mask wearing, hand hygiene, and maintaining physical distancing. Those tools will be needed before we have a vaccine and into the foreseeable future.
Okay, thank you. Let's take our first question from Paul Goff, Pittsburgh Business Times. Paul, please go ahead. Paul, make sure to unmute your microphone.
Thanks. Can you hear me now?
We can hear you. Go ahead, Paul.
Thanks for taking the time. I really appreciate it, and it's good to hear from both of you again. I wanted to talk to you a little bit more about the planning that UPMC is doing for any potential increase in cases. You know, what kind of specific things are you doing to be able to accommodate any kind of increase if it kind of got to the level of what's happening in Wisconsin or North Dakota or Iowa right now. And then also as a follow-up, just why is the rural areas, you mentioned Western Maryland and Altoona, why do you think the rural areas are being hit so hard these days?
So in terms of our preparations, we have been planning and preparing for a variety of surge situations over the past many months. And these plans are detailed, and they include how we would most effectively distribute our resources, our physical space, our equipment, and our teams, our doctors, our nurses, our respiratory therapists, in a really wide variety of surge situations. Every hospital has a detailed plan that's complemented by our system plan, and it is really the synergy between the two that enable us to expand our ability to take care of a high volume of patients in a variety of circumstances, both with COVID-19 and without.
We think we're in an excellent position knowing not only the physical resources that we have across all of UPMC, but also the human resources, the people that deliver the care. And we're in an excellent position to address the needs today, the needs tomorrow, and the predicted needs, and to make those adjustments. And we will continue to do that. You also asked, why is it that some of the rural areas are having, in a relative sense, and maybe even in some cases an absolute sense, having more COVID-19 activity? We've known since the beginning of the pandemic that viruses enter different parts of a region or the country differently. And that's due to a lot of different factors, the populations, the density, the mobility. In this particular case, some of those areas had particularly lighter activity with COVID-19 earlier on. So in a sense, when you add more activity, more congregation, some masking opportunities, you have more people available without previous protection from infection. That probably explains it, along with the natural variation that happens across regions. We've seen this for the past 8.5 months, that regions don't often have the same exact exposure. That's true across our regions, across the Commonwealth, across the U.S., and across the globe.
Thank you. Next question comes from Samantha Galvez at WPMT TV in York, Pennsylvania. Samantha, please go ahead.
Can you hear me?
We can.
Great. So this kind of falls in line with the last question, but really what has changed between March and now with the hospital's response to the virus? And what, if any, are the main concerns as you've evolved into dealing with this virus?
Well, we've learned a lot about how to initially evaluate people who present with COVID-19 infection and symptoms, and also how to provide the care. So I think we've become much more efficient. Secondly, we've talked about this before, how the virus circulates in individual areas and across the communities that we serve has changed over time, and it changes for a variety of reasons. Human reasons, weather reasons, contact and how the virus interacts with individual humans. That's changed over time. We've learned what really helps identify more severe levels of illness, what types of therapies help. We've also learned what doesn't help. And so I think that, coupled with planning, learning from other areas that had surges that they may have wished they could have handled differently, we've actually incorporated all of that into our UPMC plans, and we've been ready for months to handle way more patients than we have right now.
Yeah, I would agree. I think that we have a level of consistency around what is now known to be best practices from the perspective of clinical care and from the perspective of our operational efficiency that enables us to really deliver excellent care to COVID-19 patients.
Okay, let's go to Alyssa Raymond at WPXI TV here in Pittsburgh. Alyssa, please go ahead.
Hey there, can you hear me?
We can. Go ahead, Alyssa.
Wonderful. So back to the vaccine. Does UPMC have any say in how the vaccine will be distributed to the public, or the plan for when a vaccine is distributed, ready for distribution? Also, since it's been discussed that healthcare workers would be in that first phase of getting the potential vaccine.
So you're asking a couple questions. First, who would get the vaccine first? That means you recognize that even with this new vaccine, there'll be limited amounts of it available initially. So it will not be available to everyone who might want it. There simply won't be enough that quickly. We will clearly follow whatever governmental guidance comes down on distribution and delivery of the vaccine. We've had experience already inside of UPMC. We use the influenza vaccination season that's upon us right now to learn how to get the vaccine to the right people as quickly as possible. We will continue with that.
Another email question. Earlier in this pandemic, there were government restrictions placed on elective surgeries. Is that necessary now?
No, it is not necessary at all. The challenge is that restrictions that are that broad can unintentionally cause further harm, and it has in the past with patients. They needed care and they didn't receive it either because of the restrictions or because of misunderstanding about the restrictions. The protections now and our understanding of how to take care of people with COVID and without COVID are greatly enhanced. Each hospital has to maintain responsibility for allocating its resources, and then we use this as part of our system to make sure that we serve everyone who has a healthcare need. We don't think restricting care for some who have needs to the benefit of others, or the potential benefit, is the way to go. We think we can manage both of these and do it well, serving all of the communities that we have.
Yeah, our concern would be that patients who don't receive care early or proactively might end up becoming sicker than they otherwise would, becoming seriously ill, requiring care in an intensive care unit.
Okay, let's go to Sarah Bowden, WESA FM radio. Sarah, please go ahead.
Hi. Hi, good morning.
Good morning, Sarah.
Good morning. Yes, I was wondering if UPMC was providing the Eli Lilly monoclonal antibody treatment now that it's got an emergency use authorization. Can you hear me?
Yeah, we got it. Go ahead.
I don't believe that we are providing the Eli Lilly monoclonal antibody right now. Our REMAP platform does have the potential and is engaged in a federally funded trial of antibodies right now. And as we've talked about, we're developing our own antibody therapies in order to augment that. We think that the AB1 and the AB8 offer opportunities for enhanced antibody therapy that don't exist out there in the market now.
Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead.
Thank you. Is the case investigation and the contact tracing apparatus of the Department of Health working well? And if not, why not?
I'm not sure that I can answer with a lot of detail how well things are going at the Allegheny County Health Department or through the Commonwealth. I think that question would be best directed to them. We have inside of the healthcare system our own case tracing and contact system that's working very, very well. We work hand in glove with the county and with the Commonwealth, but that type of question is best directed elsewhere.
Okay, next question comes from Taylor Tosheff at WHTM TV in Harrisburg. Taylor, please go ahead.
Can you hear me okay?
We can, Taylor.
Thanks for holding this today. Are you guys seeing an increase of younger patients, age range about 20 to 30, that are being hospitalized?
We have seen over the past months an increase in cases in younger patients, we think largely related to social activities. In terms of our patients who are hospitalized, it tends to be that younger patients do not require hospitalization. They are less likely to become seriously ill. But as more and more younger patients contract COVID-19, they may require hospitalization.
I think it's still safe to say, and we said this earlier on, that the population who's bearing the largest brunt of bad outcomes from COVID-19 remains the elderly. Mm-hmm. It remains those who are infirmed or have other conditions. That's not to say younger people don't occasionally have a difficult time with it, but on a relative basis, they can contract the virus. They occasionally have a difficult time, but we still have to focus a lot of attention on those that are the most vulnerable.
From an ICU population, it would be unlikely or not typical to have a young person become seriously ill with COVID-19. Not impossible, but less likely.
Okay, thank you. Next question, Elena LaQuatra from WTAE TV here in Pittsburgh. Elena, please go ahead.
All right, good morning, everybody. Okay, so my question here is, it's been almost chaotic for us to try to follow all of the school districts within our viewing region. They're going from hybrid to full-time to closing down, back to hybrid, closing down. They're just back and forth all over the place, of course, as they try to navigate this and keep everybody safe. What kind of advice do you have for schools just in terms of moving forward safely and hopefully getting to that full 5-day-a-week in-person learning?
Each individual school district is responding to the children that they're educating or young adults that they're educating, the teacher population, the physical space that they have, their abilities to change some of the environmental conditions, and each is tasked to create a plan. I can't give any particular advice that would apply to every singular school district because each of them have different features like that. We have experts across UPMC that engage with different school districts. The key is to have a plan that recognizes what to do when a case is recognized, what to do when an exposure is recognized, and clear thresholds for action. It's not surprising that those might differ across different types of settings that have either different people or different resources. The key thing is having a plan and having one that is both flexible and understandable.
Okay. Next question from Tegan Simonton of the Tribune Review. Tegan, please go ahead. Unmute your microphone.
Can you hear me?
We can now.
Great. I was just wondering, earlier you mentioned that mask wearing, even if it doesn't prevent the virus entirely, it could prevent the severity of the virus. Could you talk a little bit more about that and just how that works scientifically?
Theoretically, by having a lower volume of virus, the immune system has the chance of being better able to mount a successful immune response against the virus. I think we all agree that mask wearing has two components, protecting the wearer and protecting the community. And it's really both features that make mask wearing such an important personal and public health action.
I think the way to think about this is the way you get infected is you get a dose of the virus and then you have a response of your body. And if a mask either prevents that dose or lessens the dose, the response of your body has a better chance to fight things off to the point that you either have mild infection or hopefully no signs of infection.
Okay, let's take the next question from Colleen Knudsen of WTAJ TV in Johnstown. Colleen, please go ahead.
Hi, good morning. Thanks so much for having this. My question is, there have been a lot of case spikes here in central Pennsylvania. I mean, Bedford, their percent positivity is above 17%. Somerset County saw almost 100 new cases yesterday. What are you seeing in your hospitals? What are your doctors and nurses telling you about either the patients that they're seeing or just the community transmission? Because again, a lot of these counties are also in the substantial level from the Department of Health.
Well, as you know, we serve those communities. And as we shared in the beginning of the press conference, COVID-19 is everywhere. Its penetration may vary from site to site, and some sites that had an easier time earlier in the pandemic are now having a more difficult time. Your observations are consistent with what we see from the healthcare side of it. Some of those facilities are encountering more people with symptoms, with positive tests, and benefiting and requiring hospital care. Again, one of the advantages we have in a large system is that we can help an individual hospital respond to whatever that demand is and help in that region, help shuffle that demand around and shuffle the capacity around to meet that demand much more effectively and bring the entire system in to help respond. It's one of the strengths of having not only a big system, but a well-integrated system that's connected to a world-class academic medical center.
I would strongly agree. We have leveraged our resources to move patients from areas where there is a larger volume and a hospital might be needing the assistance, and we do that on a daily basis. And I think that that creates, our team is bigger than the local team. It is the whole UPMC system team.
Okay, next question is from Jonathan Silver, Pittsburgh Post-Gazette. John, go ahead.
Thank you. Good morning. I had two questions. One kind of picks up on the previous question, but looking at the positivity rate statewide, I think our last report had that going up to 6.9%. From 6.1% from the prior week. So I would like to just get some ideas about your level of concern when you see these positivity rates going up like that. And the second question has to do with hospitalizations in your system. If I remember correctly, at the beginning of the news conference, you said that there are fewer hospitalizations system-wide since the spring. And fewer deaths and fewer need for, or less of a need for ventilators, and that Southwestern PA has about the same hospitalization rate as in July. I was wondering, though, if you could give a little more detail on what the hospitalization rates are looking like in the system. Thank you.
So we've actually seen a higher positivity test rate over the past weeks to months, as you noted. And you're asking, what does that mean? It means that there is more virus circulating in the community and producing symptoms. That's not a surprise to us. We fully anticipated and are prepared for that. The hospitalizations, we're at the same numbers of people hospitalized as back in July in Allegheny County. But again, across the system, some areas are having more hospitalizations than they experienced. That type of variation is fully expected across any pandemic. We've seen this for 100 years. We are not admitting fewer, but what we shared with you is of those that require hospitalization, there are fewer people that need intensive care or mechanical ventilation. And we're still only using a very small fraction of our total capacity to care for COVID-19 patients. We think we can accommodate more patients and even more that if they had higher needs for therapy.
Yeah, I mean, clearly the increased positivity rates are concerning to us all. We hope that this rise will plateau, but we are prepared that it won't. And the advantage of having all these months to prepare is that we have plans that can be implemented and modified as the situation changes. We're really able to be very flexible and lithe in our response.
Okay, next question, Madeline Edwards, Somerset Daily American. Madeline?
Hi. It kind of goes along with what some of the other ones were saying, like Somerset County here. Is the hospital at capacity, or any of the hospitals at capacity for their patients?
Well, first and foremost, one of the things I have to share from our view on the system side is how proud we are of how our partners at UPMC Somerset, UPMC Altoona, UPMC Bedford, and UPMC Western Maryland have responded. They've experienced a growth in virus activity that may be disproportionate to what they experienced before. And their response as individual sites and as a collective region has really been phenomenal. Those sites are working at very high amounts of providing care to both COVID-19 patients and other patients. They are not beyond their capacity right now. And we continuously dialogue with each one of those sites to say, where are you at today, multiple times a day? How can we help? How can we share the load? So I think, again, we prefer to look at this as more of a system effort and a regional effort than individual sites. We load level by looking at what each site is experiencing and how we can deliver the best care.
Exactly. I mean, I think the benefit of being part of such a large health system with enormous resources is that any one hospital never has to be over capacity. We can always share the load, move patients, move staff, move resources so that all of our sites can function optimally.
Okay, next question comes from Sami Arnedzi at WJET-TV in Erie, Pennsylvania. Please go ahead. Please unmute your microphone.
All right, can you hear me?
I can hear you.
Perfect. Hi, thank you. So as we inch closer to Thanksgiving, I guess, has UPMC across all of the branches, do you guys have a preparedness plan for a possible increase in hospitalization? I guess factoring Thanksgiving, of course, we're going to have people gathering, family gatherings, ages across the board, especially college students traveling home.
We fully expect that there'll be more people who contract COVID-19 illness and infection and will require hospitalization. We're prepared for that. We have been prepared all along. You've heard me say at many of these press conferences, we use the predictions to think about what the worst case scenarios might be, and we respond to what's happening right in front of us right now. Do a little bit of both. We are ready for any more increase in activity. We have plans that are staged and allow us to respond based on whatever that increase in activity is and whatever other needs or competing factors in delivering care exist.
That said, we are asking everybody to change their behavior over the holiday season. It is important that all of us modify how we celebrate now so that we can be together with our extended families in the future. And those changes include certainly maintained attention to masking, hand hygiene, and physical distancing, but particularly related to the holiday, limiting non-essential travel, and trying to limit the size of family gatherings to just the immediate family.
Okay. Next question, Andrea Feeney from WHP TV in Harrisburg. Andrea, please go ahead. Andrea, please unmute. Okay, let's go to a follow-up question from Bill Kibler at the Altoona Mirror. Bill?
Thanks again. Is it likely that the political rallies held by the Trump administration in Pennsylvania before the election, including in central Pennsylvania, have contributed to the current upsurge?
Well, I can't comment on any particular political rallies. What we know is that human contact is the biggest spread opportunity for this particular virus, like many other respiratory pathogens. And those opportunities can be in larger crowds or in smaller crowds. Whether or not that can be attributed to any one particular type isn't really very helpful right now. What we all recognize is things are spreading and it's happening at large events and small events. We have the opportunity to influence that now. Wear the mask, wear it right, keep some distance, no matter what reason you're congregating.
We've also learned that there is a substantial increased risk to large gatherings indoors versus outdoors. And as the coming months will bring colder weather, it's critical that we all keep that in mind.
One of the other things that happened right around the same time as the election is Halloween. And so that's another opportunity where people like to congregate. I can't quantify for you how much activity happened amongst Halloween events, but the virus doesn't care why we're congregating. We have to take that basic personal step. Wear your mask, keep a little distance, and avoid the congregation whenever possible. Think of different ways to achieve the same goals.
Next follow-up from Tegan Simonton at the Tribune Review. Tegan?
Just wondering, knowing that early on in the pandemic, there were issues nationwide with PPE, can you talk a little bit about how UPMC, if UPMC is stockpiling that personal protective equipment, and if you have any plan for if employees and essential workers start getting sick with the virus?
So we have what we think are not only excellent plans for the use of PPE that match the PPE to the actual threat, but we think that we have excellent supplies of that, and we've been working on this for months. So right now, the personal protective equipment is not a concern, and we use that as the fundamental underlying safety protector for both our healthcare workers and our patients. That is the durable thing that will help keep everyone safe. Think about it like your simple mask. It's another personal protective device. We think we're ready. We think we're ready even if the demand increases, and we think that our employees and the people who are entering our facilities understand how to use things.
We have protocols in place so that people are as conservative as possible, that we are using exactly the correct personal protective equipment for the correct situation. And we've had enormous success doing that in protecting our team and preserving our supply.
And our final question is a follow-up from Sarah Bowden at WESA Radio. Sarah, please go ahead. Sarah, unmute your mic.
Yep,
There
I
you
am.
go. Okay,
Hi. So I wanted to ask follow-up when it comes to hospital capacity, specifically with Somerset, Altoona, and the Maryland Hospital. How often do you have to move patients when they're admitted? Like, do you have some sort of triage infrastructure in place? I guess I think it would be really helpful to Pennsylvanians to understand that there are facilities that need to flex their resources because the virus is growing quite rapidly. So it'd be nice to have a little more information about how often patients have to be moved when they're admitted.
So even separate from the COVID-19 pandemic, hospitals occasionally need to transfer people for a variety of reasons. To receive care that's not available at one particular site, because sometimes of capacity issues, because a patient or family desires or wishes. That's continued throughout the entire pandemic. Nothing has changed about that. We do have constant communication and a centralized system that oversees and facilitates the transfers to make sure that we get the right people to the right place, and the two physicians that are involved with the transfer from and to a place are in communication and create the best plan possible. We think that gives our patients and our providers the best access to delivering care that's the most effective.
Through the pandemic, we've developed tools to help us understand capacity demands and constraints at our UPMC facilities, and we are really in very close contact with leadership at all of our hospitals. There is a central capacity management team, and that team works very closely throughout the day, thinking through what a given hospital needs, who needs to move a patient, and where.
Okay, and thank you. And that concludes today's press briefing. We want to thank you for attending. In about 45 minutes, we'll email the media attendees a link to download high-definition footage of this entire press briefing, as well as other still photos. We encourage you to use these in your press reports. Reporters with follow-up questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. And please remember to follow @UPMC News on Twitter for frequent updates. Thank you.